to reiterate Jane's question, what are some of the side effects? Let's start there before we get into her question directly. Some of the side effects of the uterus being removed from a female.
Okay, that was a very good question, Jane, which brings us to why people usually have a big problem with fibroids. Okay, the hysterectomy by itself, just by a factor of being a surgery, then has all the complications related to a surgery. During the operation, you can have the complications of bleeding, anesthesia, the general complications that arise from any other surgery. Okay, the hospital stay also after that is a factor. It may take a bit long, but eventually you will heal, and you will heal quite well. Okay, now the fertility question, by when we say fertility, we just mean your ability to be able to get children. Okay, this is totally different from libido, which is what people commonly are afraid of. They fear
two different things.
Yes, two different things. So people fear that their libido will go down, but in actual fact the libido stays the same. But there's something that I need to mention here. When you're having a hysterectomy done, you can have a hysterectomy, which is a total hysterectomy plus removal of the ovaries sometimes. Okay, but not in all cases. If your ovaries are removed, then the hormones that usually sustain, well, what we know as the female way, then those hormones will fall. Yeah, and so you may get the complications that appear like a menopause. Okay, so you tend to go into a menopause. Okay, but if your ovaries are left intact, then everything stays the same, so you won't have any of the menopausal symptoms.
Okay, before we carry on with that, just hold that thought. Let's take one more call. Hello.
Hello, madam.
Hi, how are you?
I'm fine, madam. I'm calling from Mombasa.
Yes, carry on.
Asking what are the causes of fibroids?
Sorry, I didn't hear you.
What are the causes of fibroids?
Yep.
And how can they be treated in those areas?
Okay, thank you. Thank you. Okay. We'll deal with that later. We're talking about the ovaries and the uterus.
Yes.
If you leave the ovaries and everything in terms of fertility, in terms of sex drive, should be okay.
Yes. Even if the ovaries are removed, then the libido by itself, the sex drive, should still be there. Okay. It may reduce because of other factors, physiological factors like vaginal dryness, which comes with the menopausal symptoms. But other than that, there is no reason why you should not be able to enjoy a healthy sex life, even after the removal.
If you remove the uterus, then the ovaries then become, so to speak, irrelevant, because then they're not being channeled anywhere. They're eggs, there's stuff that's happening, but they're not being channeled. Isn't it like one whole unit, the ovary and the uterus together?
Yes, they are connected, but they have more than one function. So your ovaries are there to ovulate and give you the fertility, which is the tendency towards getting pregnant, but they also sustain your hormones, okay? Your estrogen, your progesterone. So you need your estrogen, your progesterone. They're the things that usually make you reproductive, okay? And so sometimes, depending on the age of the patient, the reason for the hysterectomy, then the doctor can then advise whether you need to do with the removal of the ovaries or keep your ovaries intact.
Okay, and this is discussed before you go into surgery.
Yes, yes.
It's important to know.
It is important to know.
Okay, excellent. Okay, again, the caller from Mombasa, I mean, I think it's important to answer all calls. So he wanted to know the causes of fibroids and symptoms and how to treat fibroids. We've talked about it, but just run through it as we continue talking about fibroids, and we can go into pregnancy after this.
Okay. The causes that we had said, there's no one particular known cause for fibroids, but there are factors that tend to increase your likelihood of developing a fibroid. As long as you're a female in your reproductive age group, as long as if your race is a factor, so if you're black, you're more at risk of getting that. If you have a family history of fibroids, then you're more likely to get a fibroid. And also if you've not yet had a child, if you're nulliparous, then you're most likely going to get a fibroid. The symptoms, as we have said, main things usually affect your bleeding. So you'll get heavy periods, you may get a lot of cramping or increased pain, you may get bleeding in between your periods. Some people say they feel a pressure in their lower abdomen, okay? Depending on the location, if you have a fibroid pressing on the rectum at the back, then you may get constipation. If you have a fibroid that presses on your bladder on the lower side, then you may get frequent urination. Okay. So those are some of the symptoms.
Okay. Yes. Let's take another call. Hello? Hello?
Hello.
Hi.
Hi.
State your name, ask your question.
My name is Miriam. I'm 22 years old.
Yes,
last year when I was pregnant, about 3 months pregnant, I found out that I had a fibroid. Then I lost the baby, and before I got treated, I discovered that I have pregnancy again. What can be done to me?
All right, thank you very much. Thank you for leading us into our next point, pregnancy and fibroid. So I think I take it she didn't know she had a fibroid, and then she got pregnant. Then she found out she had a fibroid.
Yes.
And she lost her baby. Sorry for that. Now she's pregnant again. How can she control the situation?
Okay, well, that she brings up a very good point about what we had mentioned. Most of the people will not know they have a fibroid. Most of them are discovered coincidentally. You go in for another regular checkup, like Miriam went in for probably her pregnancy ultrasound, and was found that she had a fibroid. Okay, well, I'm not sure what actually caused the loss of the baby. It depends on whether it was a fibroid related or something else that caused it.
Can fibroids then cause you to lose your baby?
Yes, pregnancy with fibroids usually can bring a bit of complications. Okay. But generally, fibroids do not cause infertility, although they are one of the causes. Okay, depending on the location, they can block the fallopian tubes, and that can prevent you from getting pregnant. Now, when the fibroid is below the lining of the uterus, then those are the ones that make it hard for the ovum to implant into the uterus, and so you can have either difficult implantation, or even after implantation, then you can have a miscarriage. Okay, that is one of the complications that fibroids can bring about. As the pregnancy develops, the other things that she needs to look out for. Okay, she needs to have regular checkups with her doctor. They need to know where the fibroid is located, because this affects the positioning of the baby. So you can have a malpositioning, or what is called a malpresentation. Usually the baby is supposed to come down head first, and so with a fibroid it may distort the uterus, and so you get the baby maybe coming out feet first, and that is something that can be anticipated and planned for. Okay,
we've got problems.
Yes, true. But they can be dealt with. That is the thing.
Okay. So let's take another call before you finalize answering her question. Hello.
Hello.
Hi. How are you?
I'm fine.
Reduce the volume of your television, please.
My name is Naomi. I'm from Nairobi.
Yes, Naomi.
I'm in my period is irregular.
Yes.
And I'm infertile. I visited my physician.
Yes.
He just suggested I go for the theater because I have cysts.